Another interesting study I saw found that a celiac couple, heterosexual couple who were married and trying to conceive, 20% of them had infertility struggles. So there is, now we're getting the both sides of the coin, right? Female factor and male factor fertility. We know that that's obviously going to make things more difficult. And so I thought that was really fascinating as well. Women with celiac disease typically have a later time to menarche, so an older time to your first period, which we do know from the fertility data that in and itself is a risk factor for infertility, because obviously, there's something hormonal going on there. Amenorrhea, so not ovulating or not getting a period, is common with celiac disease. I would imagine that has a very large component to overall health, body weight, and nutrients, and iron deficiency, especially. If you are celiac and you're really struggling to keep your weight up and you're not absorbing your nutrients, reproductive system is going to be one of the first things to go. It's, similar to what we see with hypothalamic amenorrhea caused by eating disorders or orthorexia. It's no different, right? So that would be something else to consider. In terms of screening, if we can't find a cause for the amenorrhea, I would maybe tack that in to your list of labs just to double check and see, because it will be life-changing if you're diagnosed. I think it's both a positive and a negative life-changing experience. We've had many months now to sit with this for our family and for my daughter. And the initial weeks was a lot of, I would just burst into tears sitting there. And because I remember, oh my God, she can never eat her favorite donut again. Or, oh my God, when she goes to a birthday party, she's not going to be able to eat the cake. And I'm going to have to, obviously I'm going to send her with something, but it's just not the same, right? What is she going to do when she goes to university? I remember how hard it was for my friend sometimes to come out with us and things like that. There's so many things that it's our entire way of life needs to change then, because this is the duality of life. And I think being able to hold that duality is so important from a fertility angle, especially. But the other side of that, the end of that is, I'm so grateful we caught it at this age, because imagine her being 30 and trying to get pregnant and we find it then. I feel like the grief I would have in that scenario would be much harder, right? As a practitioner, I would place blame on myself for missing that. And so we caught it early. She's young. She fucking hates it. There's no sugarcoating it. She's not happy about this situation. And I don't blame her. And it's a struggle. And she's not well right now because of it. But she will get better.